Hello guys, so today we shall be discussing regarding the anatomy of liver. Okay, so in the abdominal part we shall be starting on with the anatomy of the liver. Now in the anatomy of the liver, first of all you have to know where is liver situated. Okay, after that we can discuss the detailed anatomy of liver. So if I make a section of abdomen, okay, let me put up the heading first. If I make a section of abdomen like this, right? So if you look at this abdomen, the center part here you find is your umbilicus, okay? And this is called as your ribs. On either side, this is called as your ribs. This is called as your sternum all the way like this, okay? Now look here, abdomen is basically divided into 9 different boxes, okay? So these are called as abdominal regions or simply called as Pandora's box. Okay, abdomen is divided into 9 different regions. Now what are these 9 different regions? Look here. So if I divide the abdomen like this, so I am dividing the abdomen into 9 different regions. How many regions? 9 regions. 9 regions of the abdomen. Now what are these 9 regions of the abdomen? Look here, we are not discussing about the remaining regions because I will tell you about the remaining regions as we are discussing the organs. But right now I am discussing liver, so I will just tell you that one box or the one region, I mean this is the region here which you can see. So this region is called as the right hypochondric region. Hypochondria, chondria means ribs, okay. So it is below the ribs basically. That is why you call it as hypochondria, and it is on the right side, so it is called as right hypochondric region, okay. So here you have got your liver. So this is the location of your liver. So your liver is located in the right hypochondric region. So from today onwards, where is your liver located? Your liver is located in the right hypochondric region. Right hypochondric region, okay. Now when you look at the liver, first important thing we need to discuss is regarding the porta hepatis, okay. All of you know that porta hepatis is consisting of 3 parts, and these are remembered by a mnemonic DAV. D for duct, A for artery, and V for vein. So what are these things? What are these 3 things? One is called as hepatic artery, another one is called as bile duct and portal vein. So this is a very favorite question for the examiner, guys. Definitely they can ask you here. So porta hepatis is consisting of what are the structures, okay. So this is a very favorite MCQ for the examiner, guys. So they can ask you that porta hepatis is consisting of what all structures. So these are the 3 important structures, like hepatic artery, there is a duct called bile duct, as well as the portal vein. Now one very important is that anatomically we need to divide the liver, okay. There are 2 types. See, liver has got 2 lobes, you know, I mean from the front side, from the anterior view. See, if you are looking at my right hypochondrium, it means you are directly looking at my anterior view. So on the anterior view, liver has got 2 lobes, the right lobe as well as the left lobe. But how are you dividing? Based upon what you are dividing the liver into right and left lobe? So in surgery, the division of liver is different. That is called surgical division of liver. And in anatomy, it will be different. This is called anatomical division of liver. So first of all, if we look at the surgical division of liver, why do we do surgical division of liver? Is for mainly for liver transplantation. For liver transplantation, we cut the liver, we choose a specific line and we make an incision and cut the liver, and right lobe we give to the patient who needs it, and left lobe I will keep it with me, okay. So surgical division and anatomical division. Surgical division as well as anatomical division. Now what is this surgical division and what is this anatomical division? Now look here very carefully. Surgical division in the sense, for example, this is the liver, Okay. Now in this liver, here all of you know that you have got inferior vena cava, right? So this is called as inferior vena cava. And this notch which you can see in the liver on the inferior angle, whatever notch you can see there, that is called as cystic notch. Why it is called cystic notch? Because you have got gallbladder there. That is why you call this as cystic notch. Okay. And this is your gallbladder. Now look here guys. For example, if I draw an imaginary line all the way from the inferior vena cava touching the gallbladder. If I draw an imaginary line like this, so this is the line which divides the liver anteriorly into right lobe as well as left lobe. So here I have got now my right lobe of the liver, and this is called as the left lobe of the liver. And always remember that, for example, whenever you wanted to do liver transplantation, so for liver transplantation, which lobe of the liver will you give to the recipient? The right lobe of the liver. Okay. So which lobe will you basically give? The right lobe of the right lobe of the liver is given for the recipient. Okay. So this is your right surgical lobe. So you basically give right surgical lobe to the recipient. And where is the left one? Left one is left with you. Okay. Left one is left with you. You are not giving it. Left one is with, it is with what? With you itself, I mean with the donor. You are the donor, right? So what is this line which is completely touching from inferior vena cava all the way to the gallbladder? So this line is named as Cantler's line. This line is named as what? This line is named as Cantler's line. Okay. So this is how we divide the liver surgically. Now, when it comes to anatomical division, how do you divide the liver anatomically? Now, look here very carefully. How do you divide the liver anatomically? Now, how do I divide the liver anatomically is that, look here. This is a cystic notch like this. And all of you know that we have got a ligament that is hanging down all the way, right? So, this ligament which is hanging down here, this is called as falciform ligament. Right. So what is the name of this ligament, guys? This is called as falciform ligament. This is called falciform ligament. Now anatomically, how am I dividing the liver is based upon the falciform ligament. Surgically it was Cantler's line, but anatomically based upon falciform ligament, I will divide the liver into right lobe of the liver as well as the left lobe of the liver. Okay. So this is called as the anatomical division. Okay. Now look here. We shall first now discuss about the segments of the liver. Now we shall discuss about the segments of the liver. I will discuss what all the ligaments we have and everything. Okay. Before that, let me discuss about the segments of the liver, which are very, very important. Now regarding the segments of the liver, two important things you have to know, that we have got something called hepatic veins. We have got something called portal vein. Now if these two things are, if you understand these two things, right, if you already know these two things, then well and good. So you will understand this everything, right? So I am dividing the liver now. Look here. This is the liver. Okay. Let us say from below here, I have got a vein that is coming up. I have got a vein that is ascending up all the way. Okay. This vein is called as portal vein. What is this vein called? This vein is called as portal vein. Okay, portal vein. Now this portal vein divides into two, the right portal vein and the left portal vein, right? So the portal vein like this, it divides into two. This is called as the right portal vein and this is called as the left portal vein. Right and left portal vein. In the same way, I told you to remember hepatic veins. Isn't it? How many hepatic veins you have got? 3 hepatic veins. For example, here I have got a hepatic vein and this hepatic vein is on the right side of the liver. So I call it as a right hepatic vein. Okay. So let me make a small correction over here. Yes, I call this hepatic vein as the right hepatic vein. Now in the same way, there is another hepatic vein all the way here. Okay. This hepatic vein is called as the middle hepatic vein. What is this? This is called as a middle hepatic vein. Now, in the same way, we have got another hepatic vein all the way here, and this is called as the left hepatic vein. So how many hepatic veins I have? I have got 3 hepatic veins. This is called as the right hepatic vein, and this is called as the middle hepatic vein, and this is called as the left hepatic vein. 3 hepatic veins. Now all these 3 hepatic veins together they join and drain into a large vein. All of you know what is the name of that vein. Look here. All these 3 veins they join together and drain into a large vein. This is called as inferior vena cava, which I told you previously, right? So this is inferior vena cava. So in this way, with the help of the bifurcation of the portal vein as well as these 3 hepatic veins, now I have divided the liver into 8 different segments. Now what are these 8 different segments? This is the first segment of the liver. This is the second segment of the liver. This is the third. This is the fourth, fifth, sixth, seventh and eighth. So how many segments I have? I have got 8 segments. I have got 8 segments. How many segments I have? I have got 8 segments. Now, if I ask you, out of these 8 segments, how many segments are of right surgical lobe and how many segments are of left surgical lobe? For example, how many segments are consisting of right surgical lobe? In the starting I told you there are 2 lobes, isn't it? This is called as a right surgical lobe, this one, and this is called as a left surgical lobe, right? So the same thing I'm telling you. Now right surgical lobe, left surgical lobe, right and left surgical lobe. So in this right surgical lobe, how many segments do actually fits in within this right surgical lobe? So look here, segment 5, segment 6, segment 7 and segment 8 are towards the right surgical lobe, right? So all of these segments are comprises the right surgical lobe. Whereas the left surgical lobe, segment 2, segment 3 and segment 4 comprises the left surgical lobe. Then what about segment 1? Segment 1 is located posteriorly. It is not located anteriorly, it is located back of the liver. Okay, when I will turn the liver back and discuss the back side of the liver, you will understand everything. Okay, so till here, these are the important things which you need to know. Now, if I turn the liver back, if I turn this same liver back, how does the picture look? So this is the liver on the posterior side. Now in this liver on the posterior side, if you look very carefully, that this is how the liver looks on the posterior side. And obviously, what did I tell you? See this point, right? So this is the point where your gallbladder is located. This is called as a cystic notch, right? So even here also, with yellow color marking I'm doing here, this is called as cystic notch. Exactly back of it. It means somewhere here I have got my gallbladder. Somewhere here I have got my gallbladder. This is my gallbladder. Okay. Now in the front, what all segments I have? I have got segment 2 and I even have got segment 3, right, near the tail portion. Now exactly at the same place, this is segment 2 over here, let us say, and this is segment 3. Segment 2 and segment 3. And next important thing is that I have got a fissure on the top here. I have got a fissure on the top. I even have got a fissure in the bottom. What are these fissures? Now this is the place where I have got a ligament. Okay, let me use another color over here, right? So this is the place where I have got a ligament, and that ligament is called as ligamentum venosum. So this will be the fissure for what? Fissure for ligamentum venosum. Fissure for ligamentum venosum. In the same way, in the bottom part also, I have got a fissure here. Here also I will get a ligament here. This is called as fissure for ligamentum teres. What is this? This is also a fissure. Fissure for what? Fissure ligamentum teres. This is the fissure for ligamentum teres. Okay, now what are these two lobes which you can see here? See, this is one lobe over here, this is the second lobe over here. What are these two lobes? Now one lobe which you can see here, right, this particular one, let me show it to you. This particular one, this looks like a comma shape, right? That is why you call it as a caudate lobe. Caudate lobe, don't confuse it with quadrate lobe. Quadrate is quadrangular, right? This is caudate lobe. Okay, now important thing to know is that I told you on the top we have got that inferior vena cava. So here is the place where your inferior vena cava is located actually. Okay, this is the place where your inferior vena cava is located. So let me put it little bit down over here. Yeah, this is the place where your inferior vena cava is located. Now if someone asks you, where is caudate lobe? Where is caudate lobe? So let me write it up, guys. Let me write it up. This is important. If you look at the caudate lobe, if someone asks you where is caudate lobe, the first point is it is located posteriorly. It is located posteriorly, right? And the second point, what will you tell? The second point, what will you tell is that on one side we have got inferior vena cava, on the other side we have got ligamentum venosum. In between both of them, the caudate lobe is present. So I can also tell that caudate lobe is sandwiched between inferior vena cava and ligamentum venosum, right? So caudate lobe is sandwiched between inferior vena cava as well as ligamentum venosum. So this is an important thing you need to know. Now, in the same way, what is this lobe called as? This is called as quadrate lobe. This is called as quadrate lobe, right? If someone asks you, where is this quadrate lobe located? Quadrate lobe is sandwiched between gallbladder as well as ligamentum teres, right? So quadrate lobe. And where is this quadrate lobe located? Quadrate lobe is located posteriorly. Quadrate lobe is located posteriorly, and yes, quadrate lobe is also sandwiched between gallbladder, GB means gallbladder, okay, gallbladder and ligamentum teres. It is sandwiched between gallbladder as well as ligamentum teres. Okay. Now, one very important thing you have to know. What is that very important thing is that, for example, if I have a collection of blood, collection of blood, you call it as hemangioma. For example, I have got a collection of blood in exactly at this part. What is this part? I think this is called, if this is right, this will be the left surgical lobe or the left anatomical lobe. Okay, so exactly I've got a hemangioma here. Let us say this is called as a hemangioma. Hemangioma, not only hemangioma, any kind of tumor it might be. So if there is hemangioma there, then what will I do? What will I do is I have to resect the liver. Now how will I resect the liver? How will I resect the liver is I will make an incision all the way from the top. From ligamentum venosum, I will start cutting down all the way, and I will pass that incision through ligamentum teres and completely separate the left surgical lobe of the liver. So this is what I do whenever I see a case of hemangioma. Clear? Okay. Another important thing is that if you see here, if you look here, ligament, what is this? This is called as the 8th segment. This is called as the 5th segment, 5th, 6th, 7th as well as 8th. All of these segments, where do they release their bile? Yeah, where do they secrete their bile? They drain their bile into the right hepatic duct. We have got 2 hepatic ducts, right? We have got 2 hepatic ducts in the liver. I cannot show it in that picture because it is already messy. So I just want to tell you that we have got 2 hepatic ducts, guys. Look here. Here I have got a hepatic duct. Here I have got another hepatic duct like this. Okay. So this hepatic duct is called as right hepatic duct. This one is called as the left hepatic duct. Now right and left hepatic duct together they join and form a hepatic duct, that is called as common hepatic duct. Okay. Again, one more important thing. I told you we have got gallbladder, isn't it? So let me draw this gallbladder with the black itself. Okay. This is the gallbladder on the posterior side. Okay. Now, this gallbladder is also giving out a duct, and that is called a cystic duct. What is that duct called? Cystic duct. So what is happening overall? What is happening overall is that this common hepatic duct as well as the cystic duct, both of them, they join together like this. They join together and they form a specific duct. This is called as common bile duct. Now this is the important thing which you need to know. So what is happening is that, for example, if I divide this liver into two halves, let us say the right side of the liver and the left side of the liver, surgical or anatomical, whatever it is, right? So the segments on the right, what are the segments on the right? 5, 6, 7, 8. So all these 5, 6, 7, 8 segments, they drain into this part. Look here, they drain into this right hepatic duct. Whereas if you look at segment 2, 3, 4, these 2, 3, 4 segments, they drain their bile into the left hepatic duct. So 5, 6, 7, 8 segments are draining. I mean, these are the segments that are releasing the bile and they're draining this bile into right hepatic duct, whereas 2, 3, 4 are draining their bile into the left hepatic duct. Now from there the bile will come all the way, enter into the common hepatic duct. From there little will be going to common bile duct. The rest will come into the gallbladder and store there. Okay, that is a different story. So what is my explanation here? Right side 5, 6, 7, 8 are draining into right hepatic duct. Left side only 2, 3, 4 are draining into left hepatic duct. Then what about the first segment? Where is first segment draining? Look here. First segment. Where is first segment? This is called as a first segment. Okay. And this is called as a fourth segment here. First and fourth. Whatever it is. The first segment directly, look at connection here now. The first segment is directly draining its contents into inferior vena cava, directly draining its contents into inferior vena cava. Okay. Now by this what I can tell you is that, for example, if there is any thrombosis of hepatic veins, okay, let us say the right, the middle and the left hepatic vein thrombosis has happened. Now when there is hepatic vein thrombosis, do you think can the bile drain into these veins? Yes, it will drain. It will drain. See, the bile can drain here, the bile can drain here, but can the bile, whatever has been drained, can it move forward crossing this obstruction? No. So in that case what will happen? There will be what? There will be cirrhosis of segment 5, cirrhosis of segment 6, cirrhosis of segment 7 and 8. The same thing on the left side also. See, 2 segment, 3 segment, 4 segment, they cannot drain. Even if they drain, the drained bile cannot move forward because of the thrombosis component there. So in that case, even the left lobe of the liver, right, the left lobe of the liver is also under necrosis. I mean, it will undergo liver cirrhosis. But only, I mean, this entire condition where there is hepatic vein thrombosis leading to obstruction of bile, right? So this is called as 𝐒𝐻𝐼 syndrome. What is this called? 𝐒𝐻𝐼 syndrome. So what is 𝐒𝐻𝐼 syndrome? Hepatic vein thrombosis. Hepatic vein thrombosis is 𝐒𝐻𝐼 syndrome. 𝐒𝐻𝐼 syndrome. Okay. Hepatic vein thrombosis is 𝐒𝐻𝐼 syndrome. Clear everyone, right? So now the important question which the examiner will ask you is not what is hepatic vein thrombosis. They won't ask you this question. What they'll ask you is, in hepatic vein thrombosis, all the segments are dead, right? All the segments undergo infarction, but there is only one segment which is safe. What is that? That is your first segment. Why? Because the first segment is directly draining into the inferior vena cava. Problem is in the hepatic veins, right? So hepatic veins are taking the blood to inferior vena cava. But if I am directly draining it to inferior vena cava, then there is no issue. So only one lobe which is spared is inferior vena, is the first lobe. Okay. In Budd-Chiari syndrome, the first segment or the caudate lobe is spared. First segment of the caudate lobe is spared. Okay, so these are the important things you have to know. Now, caudate lobe is also called as third liver, Caudate lobe is also called as a third liver. See, if any organ, whatever is there, if that has to be called individually as an organ, it should have a blood supply, it should have arteries, right? It should have ducts, it should even have veins. Only then you can call that as an organ. Now, caudate lobe has got 2 arteries, 2 veins, 2 ducts. So that is the reason why it is called as third liver. Okay, so caudate lobe has got 2 arteries, it has got 2 veins, and it has got 2 ducts. 2 arteries, 2 veins, and 2 ducts. Second important thing, let us enter into the ligament part. Now coming to the ligament part, if you look, this is how the exact liver looks. Now all of you know that this notch here is called as cystic notch, right? So this one is called here as cystic notch. Now above this also you have got one more notch here. Now what is this notch? This is called as notch for ligamentum teres. What it is that? What is ligamentum teres? I'll tell you in a minute. This is called notch for ligamentum teres. Okay, so there are 2 notches in the inferior angle of liver. One is called as a cystic notch, another one is called as a notch for ligamentum teres. Okay, now look here all the way. Now this is very important, guys, just concentrate here. Right, all of you know that we have got a ligament that is coming down all the way, right? We have got a ligament from the back side, it is coming to the front of the liver, you see. So this ligament is called as falciform ligament, I told you. This ligament is called as falciform ligament. What is this? Falciform ligament. Okay, now all of you know that every organ in our body is surrounded by peritoneum. There are 2 types of peritoneum, parietal and visceral peritoneum. Visceral peritoneum is the one which is covering the organs. So what I am trying to explain you is that on the liver also there are reflections like fans, okay, like tree leaves. There are coconut leaves, how they are radiating. So in that way there are reflections of this peritoneum on the surface of the liver. What I exactly mean is that, you see here, this is how the peritoneum is getting reflected onto the liver in this way. Okay, you see, this is how the peritoneum is getting reflected onto the liver in this way. The peritoneal folds, these are nothing but called as your peritoneal folds. So in this way, all the peritoneal folds on right and left side, they get reflected in this way. Okay, now as they are getting reflected, the lower part, they fall down, they reflect like this and they fall down in this way. Okay, look here now, they reflect and they fall down in this way. Now as they are falling down, they are making a sheath like this, they are making a sheath. Now what is happening is that, all of you know, if liver is on the right, in the center here I have got my umbilicus. So here also liver is on the right, it means the center here I have got umbilicus. Now from the umbilicus, during the development, during the fetal development, you have got a vein here. This vein is called as umbilical vein, right? Now this umbilical vein all the way comes down, enters into the sheath, and finally this umbilical vein continues down like this. But after the delivery, right, as the developmental process is progressing, what will happen? The umbilical vein disappears. All of you know that. See now, umbilical vein is disappearing slowly. Umbilical vein is disappearing. But what will happen is that whatever umbilical vein is located inside, that does not disappear. Rather, what will happen? What will happen is that this umbilical vein becomes so thick. This umbilical vein becomes so thick. So this umbilical vein becomes so thick that it converts into a ligament, and this is what is called as ligamentum teres. So that's what I told you previously, that we have got a notch here. This is called as notch for ligamentum teres. So this is nothing but called as ligamentum teres. So if I ask you, ligamentum teres is a remnant of what? Remnant of umbilical vein. Remnant of umbilical vein is ligamentum teres. Ligamentum teres is a remnant of umbilical vein. Okay. Now what will happen here? These folds of peritoneum, whatever are there, which are reflecting like this, these folds of peritoneum, they are going up. You see, these folds of peritoneum, they are going up all the way till the superior surface of the liver. In this way, they are going up all the way. Even on the left side also, they are going up all the way onto the superior surface of the liver like this. Here also on the left side, they are going on to the superior surface of the liver. Now once they are going on to the superior surface of the liver, they will form, they will sit on the superior surface of the liver, and they will make a ligament there, like a crown. You know, you put a crown onto your head, like a crown they form there, right? So that is why it is called as coronary ligament. Crown like ligament is called coronary ligament, right? So this is called as coronary ligament. Now what will happen is that this coronary ligament goes on to either edges, either side of the liver. So this coronary ligament goes on to the right side of the liver and converts into a triangular shaped ligament. Even on the left side also, it goes on to the left side of the liver and converts into a triangular shaped ligament. Okay, it will condense and convert into a triangular shaped ligament. So this is called as right triangular ligament. Right triangular ligament, and this is called as left triangular ligament. Right and left triangular ligament. Okay, we have got right and left triangular ligament here. Right and left triangular ligament. Now if I write down all the ligaments, guys, what are the ligaments which you have? So ligaments of the liver. What are the different kinds of ligaments which you have? Now look here, all of you. The first important thing, the first important ligament which you can see was your ligamentum teres. Okay, first was ligamentum teres. The second was ligamentum venosum. All of you know it was ligamentum venosum. Okay, now let us discuss the third. We have discussed on the top there was coronary ligament. Coronary ligament. Fourth important thing is that we have got the right triangular and the left triangular ligament. Okay, right triangular and left triangular ligament. And fifth important thing is we have also got what? Falciform ligament. We have got falciform ligament. Now when it comes to the lobes of the liver, how many lobes do we have? We have got the right lobe, we have got the left lobe, and we have got the caudate lobe as well as the quadrate lobe. Now when it comes to the lobes of the liver, what are the lobes we have? We have got the right lobe of the liver, we have got the left lobe of the liver, we have got the caudate lobe as well as the quadrate lobe, right, which is called as the third liver. The caudate lobe of the liver is called as the third liver. This is called as a third liver. Okay, now we are done with most of the discussion of the liver. Now let us continue with the discussion of the biliary tracts. Okay, how are the ducts that are placed within the liver? Now before discussing that story, first of all of you have to know that if this is a stomach, we have got a duodenum like this. Now what is the shape of the duodenum, guys? All of you know the duodenum is C-shaped, right? So from here all the way till here we have got this duodenum which is C-shaped. Okay, now that same duodenum, I am drawing it down, just have a look. So this was your duodenum all the way. This is your duodenum all the way here. Okay, now we have got liver on the right side, right? We have got the liver on the right side like this. Okay, next important thing is that here you have got an organ. What is that? This is also called as a mixed gland, and this mixed gland is named as, this mixed gland has got a head, it has got a body as well as the tail, and this is called as your pancreas. All of you know this. Now what I am trying to teach you, is that here I have got a duct called as right hepatic duct. Here I have got a duct called as the left hepatic duct. Okay, so let me write it down. This is called as a right hepatic duct. This is called as a left hepatic duct. Now the right and the left hepatic duct together, they join and form a duct. This is called as a common hepatic duct. What is this? Common hepatic duct. Not only that, we even have another duct over here. This is called as the gallbladder, right? So from this gallbladder, we even have a duct over here. This is called as a cystic duct. So this is our gallbladder like this. Okay, and the name of this duct is cystic duct. So the common hepatic duct as well as the cystic duct, they join together and form common bile duct. What is this duct? This is called as common bile duct. Okay, now forget this story here. Now another important story is that within the pancreas, we have got another duct over here. Very important, guys, just concentrate here. Within the pancreas, we have got this duct. This is called as a main pancreatic duct. Okay, what is the name of this duct over here? Main pancreatic duct. This duct is called main pancreatic duct. Now main pancreatic duct divides into two ducts. One is called as accessory pancreatic duct, another one is called as the main pancreatic duct itself. Okay, so this main pancreatic duct gives out a branch that goes onto the top like this. Now this branch is called as accessory pancreatic duct, whereas the next one is straight like this. This is called as your main pancreatic duct. Okay, so let me highlight it. See this part which I am shading it right now, this is your main pancreatic duct. Okay, this is your main pancreatic duct, and the other one is called as your accessory pancreatic duct. This is called as your accessory pancreatic duct. Okay, now look here. This common bile duct comes all the way like this. It passes behind the duodenum, and look what is happening here. It passes behind the duodenum and it joins here. It joins with this duct over here. It passes behind the duodenum like this, and you see what is happening here? You see here, what is happening is that the common bile duct is joining with the main pancreatic duct. Now once the common bile duct, let me put up that picture down here more clearly, guys. So this is what it is happening actually. Yeah, so look here, this is your main pancreatic duct. Okay, this is your common bile duct. Now the common bile duct and the main pancreatic duct join together to form this duct. This duct is called as hepatopancreatic duct. This duct is called as hepatopancreatic duct. Now this hepatopancreatic duct is having a small sphincter on its top. Okay, this hepatopancreatic duct is having a sphincter here. Now the name of this sphincter is sphincter of Oddi. What is the name of this sphincter? This is called as sphincter of Oddi. The name of this sphincter is sphincter of Oddi. And this opening, whatever is there, this opening is called as hepatopancreatic ampulla. What is the name of this opening, guys? The opening is called as hepatopancreatic ampulla. or we also called as ampulla of Vater. Ampulla of Vater or hepatopancreatic ampulla. Okay. Now, obviously all of you know within your mouth also you have got papilla, right? So here also you have got papilla, guys. Look very carefully here. You have got a papilla all the way like this. Now this papilla which you can see here, this is called as superior duodenal papilla. Whereas there is another papilla over here which you can see. Now this is the papilla where your accessory pancreatic duct will drain. Okay, so the papilla through which the accessory pancreatic duct is draining, this is called as inferior duodenal papilla. Now don't go based upon the locations, it is based upon where the main pancreatic duct is opening. If main pancreatic duct was opening top, that was called as superior duodenal papilla, but main pancreatic duct here it was opening in the bottom, so this is called as superior duodenal papilla here. Okay, so this papilla is called as superior duodenal papilla. Okay, in the same way this papilla over here is called as inferior duodenal papilla. Inferior duodenal papilla. So these are all the important things which you need to know regarding the liver. Thank you so much for watching my video.